Hello, I'm Stephanie.
And I'm Lauren.
And this is Ive Got Guts, a podcast about living and thriving with chronic illness.
And all the things that take guts to say out loud.
We're here to talk about the hard stuff, the stuff that's messy, complicated, and often left unsaid.
From chronic illness to everyday life, we're creating space for honest conversations, real connection, and a lot of laughs along the way.
And just so we're clear, we are not medical professionals. We're just two best friends sharing what we've learned and what we're still figuring out.
So you don't have to do it alone.
Hello, everyone.
And welcome back. Happy Monday.
Happy Monday.
All right, here we go. Let's dive into our thorns and roses.
What are we starting with, Room?
Give us your thorn first.
Thorn? Okay.
Yeah, let's just do it.
I'm starting to really feel nervous about my surgery. And it's still a week and a half away.
It is. It's coming because it's February 5th, right?
Yeah.
Getting closer every day.
Getting real nervous. I had my pre-op call with the doctor.
And how did it go? Tell us.
It went good other than the fact that I felt like we were on a time crunch. Like, first of all, the call was supposed to be at 6:45 in the morning, which is already fairly early, right?
Wait a second. What time is he calling you?
6:45 in the morning. But he ended up calling me at 6:30 in the morning. Luckily, I answered.
Wait, what day was this?
Thursday.
That is really, you did. We talked and you were like, I was wondering about the time frame for that.
Real early. So I think because he normally works at a fertility clinic and he only does surgeries on Thursdays, I believe. So he's probably gearing up for a day of like egg retrievals, transfers, whatever. So I'm probably like before all of that, you know? But it did feel fast. He did start off with like kind of answering my questions before I even could ask them, which was nice. And he did say something very comforting. He said, I would treat you as if you were my own daughter, which was nice.
I love that.
But he explained, if it's really surface level, I will use ablation, which I don't love because ablation means burning.
Ablation means burn. So they would burn the endometriosis away.
Which isn't great because that's just you're not getting to the root of the problem. You're just kind of like burning the surface. But he said it's only for surface level. He said if he finds anything deep, he will excise it as best he can. But if he gets to a situation that is too tricky or complicated for him, he's not going to do it because he doesn't want to make anything worse. And he said specifically, he was talking about the bowel. He was like, if it is in your bowel, I will not touch it because you need to have somebody who specializes in that.
Okay.
So I do appreciate that.
Yeah, because the endometriosis can grow
anywhere. It can grow on your bowels. It can grow on your lungs, your brain, like it can be all over.
Wow, it can get up to your brain?
It can get anywhere. It can be in your mouth.
And you can't see it on a CAT scan or an MRI.
You can sometimes see it on an MRI, but
not always.
Endometriosis comes in many different shapes and forms. It can be pink and blue and clear and white and black and brown, and it comes in so many different forms. So,
I did not know this.
Yeah. And I asked him how long the surgery was. He said like about an hour, give or take. The only thing that I think is crazy is I said, what's your pain management plan? And he said, you'll come home and rotate Tylenol and Advil. I was like,
oh my gosh, he's giving you Tic Tacs and Smarties?
I was like, so you're going to cut me open and you're going to mess up, maybe potentially burn my insides and take part of my insides out. And you are telling me Tylenol and Advil. I was like, okay. So I did advocate. I was like, I have been having a really rough time with recoveries lately. Recoveries that shouldn't be rough are really, really rough for me. So I was like, that's not going to work for me. I was like, I'm going to need something a little more than that at least for the first couple days to get me through.
Right.
What is wrong with people these days?
It's just so crazy. Like I do understand that there was a problem, right, in the medical field with narcotics.
I didn't cause it.
Right, exactly. But the purpose of narcotics or any type of pain med is to help your body heal. So you take them so that you can relax and let your body heal. And it's a short-term couple of days. But the problem is that it was abused over the years, right? And now it's like they are just so restricted and
go back and look at my chart.
Right.
The only time I've ever used it is to recover from a surgery, and I've never asked for more.
Right. It's not like you were popping extra pills and looking for more or whatever else. You're genuinely wanting to make sure that you can be as pain-free as possible post-recovery to heal.
But I got to be honest with you, I don't think he liked it that I advocated for myself.
Oh boy.
He got a little short with me and he was like, well, I'll make a note in your chart. He goes, but I don't think you're going to need it. He's like, see you on the 5th. And he hung up, which left me feeling like shit after the phone call. And I don't think that you should have to feel that way when you're like doing something that's scary and big. Like a procedure like that should not, Tylenol and Advil should not be the first go-to for someone.
Right. Or here's the thing though, it may be enough for someone, but there should be like a process, right? Or like tiered things. Like, we're going to try this. If this doesn't touch your pain, then logically, then this is the next step, or this is the next step. Everybody is different. Everybody's wired in a different way. Yep. Didn't you share that somebody had the same surgery and they healed with like gabapentin and something else? I don't know who that was.
Yes.
But
like, she was given opioids.
And she chose a different path. Right. So
she actually did use the opioids for the first 2 days, though. Okay. It was beyond that she chose
something else. Right. Yeah. So it just shows everybody is different, and you have to advocate for yourself. And
but I'm just getting so nervous. I know I understand. Well, surgeries are scary for me.
They are.
For everyone who might just be joining us, my gastroparesis was caused by surgeon error. Also, my ineffective esophageal motility was also caused by that same surgeon error. So for me, surgeries, it's a PTSD thing. Like surgeries are always going to be really scary for me.
Right. And it's like all the things that you're doing to prepare your mind and your body prior. Like, look, advocating for yourself, giving yourself peace that you have options to take when you're in pain, right? And it's going through those motions, which you're trying to do. And Rome, it's going to be amazing. This is just yet another step, another piece in the direction of getting you baby.
I know.
This could be good.
Have to get through it.
This could be good.
Oh, what's your thorn room?
Well, it's just my esophagus again.
Think you sell stinker.
It is being a little stinker. I've been having a hard time getting food in me. And we just actually, before I came here tonight to record, we went to 110 Grill, which they are amazing there. They have a gluten-free menu and they have very safe for people with allergies, and the waiter or waitress does not bring your food. The manager does and says this is a gluten-free and it's got an allergy stick. So if you have a 110 Grill by you, I highly recommend.
Great option.
Really, really great option.
Food's good too.
It is so good. So good. And like I just have been struggling to get food in me, and it's been really heavy. And it's 3 months since I've had my stretching. And this is about the time. There's sometimes I need a balloon dilation 3 months, 4 months. Sometimes I can make it to 5 or 6. Yeah. It just really depends on what my body is handing me. And it was, so I did get the clam chowder soup, which was so delicious. But like, I really wanted to get fried pickles, mozzarella sticks, a turkey burger, fries, and vanilla ice cream for dessert.
It's one of those, your eyes is bigger than your belly.
I'm just looking around, I'm like, God, there's just so much more. But I'm like, I'll take the soup. And then Connor got a gluten-free fish fry and fries and broccoli, and I was like picking on his, but it's just really hard. Like right now,
something to go so you could have it when you're feeling better the next couple days.
The thing is that where I'm at, I know it's time for a dilation, and I can't.
Oh yes, we talked about this the other day.
Yeah, it's like it's not normally. It's like, oh, I can get that in me. Like if I knew I could get that turkey burger in me, I would order it, take 3 bites, and take it home. I know I can't process a turkey burger.
Yeah. You got to call and get a stretching.
We went to Red Robin after Connor's concert.
You couldn't eat anything.
I couldn't. So we went after his band concert. He's playing the trombone. He's so handsome up there. Just blowing that trombone. I got to tell you, that trombone makes quite the sound.
You would know.
But we went, and I just knew. I'm like, I love my my teriyaki burger, but I knew I couldn't do it. So I ended up just asking them to slice an avocado for me. Yeah. And I got a thing of fries. This is where I'm at. So I called my thoracic surgeon. So this leads into my rose. So here's my rose today. So, and then you can say your rose. So I'm like, okay, I need a stretching. So I usually been getting my stretching from my gastroenterologist. And since the fall and everything with all my testing done, and we know where my esophagus is at, now my thoracic surgeon will be stretching me as my primary point person, which I do miss my gastro a bit, but
I know.
just kind of want to check in with them, see how the fam's doing.
I know.
Like, I feel like we're
Only
like
you.
connected. But so anyway, so I call their office, and when I got the news about my esophagus, Dr. Jones was like, well, it's up to you. We'll book a stretching in 6 months, which would be May, but if we need it sooner, we'll do it sooner. So I called, and I literally called whatever day it was. Let's say it was Tuesday. I call on Tuesday. I talk to the lady. Within 30 minutes, somebody calls me back.
What?
And she's like, okay, I just want to ask some clarifying questions. I gave her the whole lowdown about how much food I'm getting in me, how I'm barely getting anything in, how I'm feeling, the nausea, the pain, the spasms I've been getting. So I go through all of it, and I'm like, I would like to move it up, but whatever Dr. Jones thinks is whatever. So she hangs up, relays it. Then the PA calls me.
Oh, wow.
Martha. Love Martha. Martha not only recounts everything, asks me what I've been eating, how I've been eating, how my weight is. Then she's giving me advice on different things that I can do and eat. Because I told her, I'm like, well, I tried some fries. She's like, all right, let's focus on some nutrients. So she was giving me some ideas to how to make a smoothie that's not so thick. Because like having a smoothie or a milkshake, it's too thick and heavy. Like it's like a weight. I need something light. So she was so wonderful. She spent like 20 minutes on the phone talking to me. And it just like that is my rose. Like it just made me, she was just giving me such like kindness and just like love and support. And it's exactly what I needed, you know?
Do you have a stretching schedule?
February 18th. She's like, here's the thing. The soonest like non-emergent appointment is February 18th. She's like, do you feel like this is emergency? Because we can get you in next week if it is. I'm like, no, it is not emergent. Like, I'm not like, she's like, are you losing any weight and can you get food down? I'm like, yes, I can. It's just, you know, I know it's getting tough.
Right.
I'm like, she's like, well, we'll do February 18th, but if you need it sooner, you call me, we'll get you in within 2 days. 2 days because Dr. Jones has like emergency appointments for her achalasia patients who need to get in. And I just got off the phone and I like almost started, I was in the hallway at school, of course, when I got the call, and I almost started to just break down with like tears of like gratitude and just joy of like, wow, this feels different than getting stretched by my gastroenterologist. It felt just very supportive. I felt heard. She documented it all. 3 people ended up talking to me that day, and we got it booked. It's not like I was being brushed off or made to feel a certain way. And it was just such a bright spot in my day. So that
makes me so happy.
My rose. So don't worry, esophagus. We're going to stretch you soon.
There you go.
Keep
reassuring your esophagus.
So that was my rose. I love Dr. Jones and their office. They're amazing.
I'm glad.
Yes. What was your rose?
My rose is a very simple one.
I love it.
This is one of those weeks where it was hard to find a rose. It was a tough week for me. Work was really rough. I wasn't feeling the greatest. I had one of the worst periods I've ever had in a long time. So it was hard to find a rose, but Friday night, Anthony, we're having like a crazy storm. It's freezing cold. I was like, I want like just a cozy soup, something warm to put in me. And there is a new Thai restaurant where we live in Webster. It's called Get Tied Up.
Ooh, Get Tied Up.
It's actually really cute inside.
Did you guys eat out there or did you take it to go?
No, we went and sat in the restaurant. And there's this soup that I've been like fascinated with over the years. It's called Tom Kha, and it's just like a very gentle coconut broth based soup. It doesn't have noodles in it. It has like whatever protein you want, and then mushrooms and cilantro. I have tried to make it. I said to Anthony last night, because this is my first time ordering it from a restaurant, and I'm eating it, and I'm like, oh, this is so good. And I'm like, I have tried to make the soup like at least 17 times over the years, and it has never tasted like this. So just goes to show I am a very good cook, but there are some things I cannot master on my own and are best made in a restaurant by the professionals. And this I now know is one of those things.
Yay.
But it was so comforting and cozy, and it was such a cold night. And Anthony's never really had Thai food before other than like quick to go pad Thai from like a freezer section at Aldi's. This was his first real Thai food, and he really enjoyed it.
I love this for you guys. It's so fun to find like a new place that's delicious. Is it gluten-free?
Yeah, mostly gluten-free, the whole menu.
So I had a bad experience.
You did. But that was a long time ago.
We're talking like 17 years ago. I had Thai food and it was delicious. And I was told it was gluten-free and it wasn't. So that night I got violently ill and was throwing up. And I feel like it's like one of those things when you throw up. I threw up Thai food. I'm like, I could never look at it again.
Yeah.
I mean, it's been 17 years, so maybe I can give it another shot.
Yeah, maybe.
Back then I was getting poisoned way more than I am today.
This place seemed really on top of things. It was so delicious.
Ooh, yes, yum. All right. Well, got to check it out. Maybe I'll get the courage to go.
All right, so quick Cozy Earth update for you guys. Their prices are officially going down, which means that the discount is shifting from 41% off to 21% off. But here's the important part. Because the base prices are lower, this is still going to be the best deal you'll ever get on Cozy Earth.
Sure is. So right now you can still lock in 41% off through February 28th, 2026. Which beats any future sale. And all you have to do is use our code IGG at checkout.
Cozy Earth is my go-to for the softest, temperature-regulating bamboo sheets, pajamas, and loungewear, especially when I'm prioritizing comfort, rest, and nervous system regulation. Definitely doing that right now.
For sure. So if you've been waiting, this is your sign. Quickly, hurry up. Use code IGG for 41% off now or 21% off after the price change. Either way, you're getting the best deal available anywhere.
All right, let's get into this interview. Today, we are really excited because we're sitting down with Dr. Jason B. Carter, a board-certified urologist who's been caring for patients for decades.
Dr. Carter has been providing urologic care since 2003. He earned his medical degree from East Tennessee State University, completed his residency at University Hospital and Clinics in Columbia, Missouri, and opened his private practice in the Greenville, Tennessee area in 2006.
He's also board certified by the American Board of Urology and is a member of the American Urological Association and the Tennessee Medical Association.
What we really appreciate about Dr. Carter is his whole person approach, because so often in medicine, things can feel really test focused or procedure focused. And when you're the patient, it's easy to feel like you're being treated in pieces instead of as a full human.
So today we're digging into the connection between gut health and bladder function, why hormone balance matters so much, especially for women, and what gets missed when we don't zoom out and look at the full picture.
And we'll also talk about the lifestyle choices that really matter long term, because prevention and support shouldn't start only when things feel urgent.
Dr. Carter, we're so grateful you're here. Welcome to the show.
Well, thank you. It's good to be here.
Well, Dr. Carter, you have been practicing medicine for over 29 years. Tell us a little bit about yourself and what drew you to the medical field, specifically urology.
Well, it's kind of interesting. I think probably one role model I had was my uncle, was a physician. And so that probably planted a seed early. To be honest, I always, school was easy for me. Mm-hmm. So I always excelled in academics. So, going to school was fun for me and I enjoyed it. I just kind of gravitated toward, medicine. I thought it would be a career and a lifestyle option that would, enable me to help people and hopefully try to make the world a better place. It kind of sounds corny, but, just to kind of do my part to make things better. And hopefully when you're gone one day, you can leave behind a legacy where you helped a lot of people and tried to make the world a slightly better place.
Absolutely.
I've been practicing now, in private practice for, about 23 years. If you include my residency training in urology and general surgery, I've been, practicing medicine for about 29 years, but 23 years in private practice. And I've just always been sort of a general urologist. I don't have, a subspecialty, but have just treated a variety of conditions and treated all the patients that, we feel comfortable treating within our area of, skill, knowledge, and expertise. So we, treat men, women, treat mostly adults, some children, but treat all ages and try to treat, I really try to help everybody who comes through my door. Mm-hmm. So it just requires, being very, good at a broad area of things and, just trying to be helpful any way that you can.
Mm-hmm. Yeah. Yeah. That's amazing.
It is.
Can you share your thoughts on gut health and bladder function?
Oh, yeah. I mean, I think, certainly when patients come in, as a urologist and they are having bladder issues, one thing that I always try to ask my patients is about their gut health. Mm-hmm. So gut health is very important to bladder health. And unfortunately, basically in kind of the world that we live in here in the United States, people usually, a lot of my patients do not have good gut health. So the American lifestyle is just not really set up to promote, truly, healthy lifestyles and healthy body function unless people take a particular interest in it for themselves and try to do the right things. And certainly, as urologists, we see all ages, but we do see a lot of older patients who, as patients age, they will normally have some type of bowel dysfunction as they age. And a lot of times nobody's really addressing that. Mm-hmm. And then when you talk to patients who will claim to have good gut health, if you do some type of imaging study or you review imaging studies that have been done when they present to the emergency room or maybe something's been ordered by their family doctor, a lot of people are obstipated is a common term, or constipated, and don't even really realize it. Yeah. And then, there's a lot of kind of, we talk about urinary frequency and urgency. A lot of patients too, have, fecal urgency and incontinence, which can definitely kind of affect bladder health and contribute to a lot of different things with the bladder. So I think there's definitely a big connection. I think, honestly, a big part of it is trying to get the patients to recognize that and then trying to give the patients like reasonable options that they can try to put in place to kind of get their gut health a little bit better or hopefully a lot better.
Yeah. It plays such a vital role. I mean, I know
everything.
Us and so many of our listeners, struggle with gut health, and it's all kind of goes hand in hand.
Yeah.
Well, let's move into hormones. I know when you and I chatted a little while ago, we talked about hormone balance, and how important it is to overall health, especially for women. Why do you believe hormone therapy can be so impactful?
Well, I mean, I think that, it's really kind of hard because I think men and women are kind of two different subsets of patients when it comes to hormone therapy. Mm-hmm. I think for men at this point, I started, really seeing men for testosterone deficiency several years ago now. And we're kind of in a different space for men. The testosterone replacement therapy is very common. A lot of physicians provide that. Some do it better than others. Some have a bigger knowledge base. But women have always kind of been a harder sell, in my opinion.
Yes.
Now, I'm a urologist. I really try to diagnose and treat hormone deficiency within the space of people who come to my office with medical issues who I think would benefit from hormone deficiency. I've never really advertised myself as a hormone clinic or a hormone doctor. So I think there's a little bit of a difference there. Yeah. So the patients that I'm seeing may not necessarily be your younger, healthier patients who are maybe going to a hormone clinic. We're seeing patients who wind up in a urology office, but we try to help them understand how important hormone, deficiency diagnosis and treatment can be for their individual condition. Mm-hmm. And I certainly wish we saw more women. Yeah. A very common thing that I see is that women will initially approach their gynecologist with symptoms of hormone deficiency. And a lot of times it's just not really addressed or appropriately treated. Mm-hmm. So patients are because for a lot of women, the gynecologist is your first kind of person, right? It's your go-to doctor. It would be very natural for the gynecologist to help diagnose and treat women for hormone issues, but that often doesn't happen. And so a lot of times women either go without treatment or they wind up at a hormone type cosmetic type clinic where sometimes they're getting appropriate treatment, sometimes maybe not. It can be expensive. They can kind of be told that it has to be done a certain way when it really doesn't. So, we really, try to encourage a lot of our female patients, to understand that hormone deficiency can be a big part of the issue. And I think if you're in that space and you listen to thought leaders and you try to stay educated, just the notion that hormones are very, very important for health, I think are going to become much, much more commonly talked about and openly discussed. The new classification, urology is genitourinary syndrome of menopause, but you could probably also coin a term gastrointestinal syndrome of menopause. So, for women out there, if you have suboptimal estrogen or progesterone levels, that can definitely affect your gut function. It can definitely affect your bladder function, and it can also make you much more prone to urinary tract infection. So, we certainly, for all our women who come in, really talk about hormone deficiency. We encourage them to get tested, and then we go through treatment options for them and hopefully can find something that they're comfortable, starting with.
That's really encouraging. I mean, I'm currently undergoing IVF, and even then having someone run a hormone panel on me was difficult. Yeah. Nobody wanted to do it.
Yes. And that's a common refrain I hear is, I mentioned this to my gynecologist, but they didn't order any labs, or they tell me all I need is a birth control pill, or they tell me that I'm fine, I don't need anything. I would encourage all young women who begin having symptoms, of anything. It's very, very easy to check a hormone panel. I think the problem is finding people who are knowledgeable to interpret it and how to use that information to start making some treatment recommendations. But I really encourage women to take more ownership over that and really seek out physicians who are qualified and knowledgeable in that area, because I really, really think a lot of issues for men and women really boil down to hormone deficiency.
Yeah. If it wasn't for my husband's urologist, we wouldn't know that he actually played a part in our infertility. So I'm grateful for your urologist every day.
Well, we try to do our part.
So you shared that a lot of modern medicine can feel very procedure focused, scopes, tests, quick answers, whereas you prioritize overall patient care. So what do you think gets missed when we only look at isolated systems instead of the full picture?
Well, I think what gets missed is you just really don't understand. When you see a patient, and when I have a patient come in for, say recurrent UTIs, very, very, very common, or maybe, overactive bladder, frequency, urgency, maybe pelvic pain, suprapubic discomfort. I think the diagnostic process is important. Because I think one thing that a lot of people come in, because by the time they see a urologist, they've probably seen other physicians. They've seen their primary care provider. They've maybe seen an emergency room physician. They've maybe discussed issues with their gynecologist. I might be the third, fourth, or fifth person that they've seen, and they could have symptoms going on for months to years. And a lot of patients come in very concerned that something is wrong.
Yeah.
So I really do think it's important to go through a proper evaluation and reassure the patient mentally, psychologically, that we're not dealing with something serious, right? We may be dealing with an anatomic, maybe a physiologic issue, but for a big patient, a lot of times it's the fear of cancer, right? When say, listen, well, we've got you checked. We don't see any sign of cancer. We don't see any sign of a stone. We don't see any sign of some type of a blockage or restriction in a flow. But, what really is important, and I think a lot of times which doesn't happen, is just sitting down and having a conversation with the patient and giving them time to explain to you what bothers them.
Yes.
You know, why did you come in today? What is your primary concern? You know, what do we need to do to help you? And you also have to have experience, seeing patients and asking the right questions so you can hone in on a diagnosis like, well, this isn't UTIs. This is probably genitourinary syndrome of menopause. This isn't UTIs. This may be chronic pelvic pain syndrome or interstitial cystitis. Or, part of your UTI issue may be that you have fecal urgency or incontinence or constipation. But a lot of times, I just really honestly don't think patients take the time to sit down and have a conversation with a patient and try to let the patient, if you listen to the patient, most of the time they can tell you what's wrong with them, or they can tell you what they need to feel better about their problem. Right. And I feel one reason that we've been successful and have built such a large practice is I think we just listen to patients and we answer their questions and we take time to explain. And that's always been a real priority of mine. I mean, with the time that I practice and the number of patients that I've seen, I have an algorithm in my head. And I have a management approach that I try to standardize. And what that allows us to do is have a standard way to treat patients, but save a lot of that clinic visit to actually just talk to the patients and have a conversation.
Yeah. Right. So it's how you're structuring your time together and approaching it.
Yeah, it's how you structure your time with the patient. And you really have to really make an effort to spend as much of that time as you can just listening to the patient and having a conversation.
Yeah. And I feel like that's what so many of us want. We just want to feel heard, right? And validated. And then just that level of compassion, and I feel it as you talk, and it's so refreshing.
It's refreshing. It's also reassuring that you want to get to the root of the problem. I mean, I can't, how many times have I gone to the doctor and they're just like, oh, it's UTI, and they give me a medicine for it and you go on with your day. But what's really causing that? I like that you want to get to the root of the problem.
Yeah. I think it's really important, and I think it's very refreshing to hear.
Yeah.
Well, and the other thing, I was thinking about this podcast and thinking about some of the things we might talk about. And, one thing that I'll always have a conversation with patients about is, it seems so simple to give a urine sample and get a diagnosis of an infection. But honestly, it's probably one of the most difficult things that physicians, that providers and patients try to do. And, we have conversations, but, I can't tell you how many times I'll see a patient with recurrent UTIs and they might have had 10 urine dips and 1 urine culture, right? Or they may have had a microscopic urinalysis, but not a culture. Yeah. And then you see the urinalysis, but you can tell it's contaminated because they really weren't given instructions on how to provide a proper, clean catch midstream urine sample. So, UTIs, I think, are one of the most overdiagnosed conditions in urology. And a lot of it just boils down to the easy thing to do is you see a patient, dip a urine, give an antibiotic, send them out the door. And you do that 4, 5, 6 times. They've got a diagnosis of recurrent UTIs. And then it's really kind of my job to try to come in and kind of figure out, well, what's really going on here.
Right.
Yeah.
Right. It's like putting all the pieces to the puzzle together to figure out what's happening. Yeah. And I know that you work with many patients later in life who are trying to change just long-standing habits, after how many, 40, 50, 60, 70 years. For our younger listeners, which we do have quite the range of listeners, what lifestyle choices do you believe make the biggest difference long-term?
Well, I mean, I think the biggest differences are just trying to commit yourself to living a healthier lifestyle. I mean, I think we know that one of the biggest issues we have in America is an obesity epidemic. And a lot of times that just simply goes back to poor lifestyle choices, poor diet, inactivity, stress, poor sleep. And I think it's just the simple things that people can really focus in on that make a huge difference. Because we see a lot of young patients and they come in and, have questions about, why am I going through this? Why do I have low hormones? Why do I have these issues? And, for a young patient who's relatively healthy, a lot of this just goes back to lifestyle choices. And of course, it's hard to live a healthy lifestyle.
Yeah.
But, for patients, you can't really overemphasize hydration. Just making sure that you drink, plenty of water. A lot of times, patients are over consuming caffeine, coffee, tea, soda, carbonated beverages. So really just staying hydrated with the water is really good. Trying to have a reasonably healthy diet, avoiding ultra processed foods, certainly, trying to cook more at home, or if you are eating out, trying to make healthier choices. One of my favorite places to go is I don't go a lot, but we do try to cook a lot at home, but I love going to Applebee's.
Yeah.
Because I think about getting that, that bacon cheeseburger with, and, Applebee's has the calories on the menu.
They do.
Yeah.
And you check that menu out and you got to think, well, is it worth the calories?
Yeah.
I think if all restaurants did that and people actually paid attention to that, you could have a sirloin with some steamed broccoli and maybe some garlic potatoes for about 600 calories. Or you could have that quesadilla cheeseburger for like 1,500.
True.
But, so eating a healthier diet, certainly staying active and getting more physical activity is very important. I think, if you're in the hormone, longevity, wellness space, I think certainly, activity is important. What's really important is lean muscle mass or skeletal muscle. And I think that people are healthier and live longer, healthier, productive lives if they commit to exercise that includes weight-bearing exercises, and they really try to commit to kind of building some, and maintaining skeletal muscle mass. I think another very important thing is sleep hygiene, and that's something that I struggle with every night.
Same.
Same.
It's making sure, and sure, we have those unicorns that can get 4 hours of sleep and feel great. But, you really want to try to commit to 7-8 hours of sleep, good sleep hygiene, getting ready for bed, kind of setting your mind and your body up for that, trying to have a healthy sleep environment. But then another thing is just stress. And, we kind of live chronically stressed lifestyles. Work, family, finances. And when you're under chronic stress, you have elevated cortisol levels, which suppress other healthy hormones and just kind of, are conducive to a pro-inflammatory state in your body.
Yep.
So, it's really easy things, right? It's like hydrate, eat healthy, get regular exercise, sleep well, avoid stress. But those lifestyle changes are the most difficult.
Right.
And I think that's unfortunately why Western medicine is always kind of falling back on x-rays, blood tests, medications, and ways to treat patients, as opposed to just trying to address the lifestyle issues that are really important.
Yeah, I agree.
Yeah, I couldn't agree more with that. And you're so right. It's so hard. I know you mentioned sleeping can be challenging for you too, right? And it's like there's so much to do, and sometimes we can't turn our brain off, right? But the mornings when I wake up after I've had a great night's sleep, you feel the difference compared to other mornings.
You
right?
do.
And it's crazy.
Yeah. And I would encourage people too, I did it once and it was shocking for me. I wore a smartwatch, to bed one week. And those probably aren't the most accurate, measurement tools, right? But, it's not just the sleep, but it's making sure you set yourself up for that, hopefully getting that good, healthy REM sleep.
Yeah.
And, typically I was maybe in bed for 7 to 8 hours, but I might have only been getting 3 to 4 hours of healthy sleep.
Which is crazy.
Yeah. And, and also I would really encourage, probably a really hugely underdiagnosed condition is sleep apnea.
My husband has that.
Yeah. And it's for a lot of patients that we may be diagnosed with low hormone, Maybe we get them on proper therapy. They're still feeling fatigue. I'll recommend a lot of those people just do a home sleep apnea test, which is much simpler than a true sleep study test in a sleep study lab. And lots of patients, have sleep apnea. And you talk to patients who have sleep apnea, and unfortunately, a lot of them aren't compliant with their CPAP.
Oh,
so, so things like, but, even if you just slap a smartwatch on, wear that to bed one week and look at your sleep patterns, you'd probably be shocked at how little healthy sleep you're really getting.
Right. That's a great tip. I've got to try that.
Yeah, and that's probably why half of us are like, but I slept 8 hours, but I still woke up exhausted.
Right.
But you've got to be setting yourself up for that healthy REM sleep.
Yeah. Right. Any tips for if you're struggling to sleep or fall asleep? Do you have anything that works for yourself?
Well, I just think the biggest thing is, I'm a big, I love my evening cocktail. That's me. We usually have wine with dinner, but, I think especially as you get older, you've really got to make an effort to make sure that you're being careful about your alcohol intake, right? Maybe one cocktail earlier in the evening, maybe a glass of wine with dinner, but you really have to watch alcohol consumption later in the evening. You really have to watch caffeine consumption, later in the day. So be really mindful about your caffeine, be really mindful about your alcohol. I think that you really have to, turn that TV off, turn that phone off, calm your mind down an hour or two prior to bed if possible, certainly 30 to 60 minutes. You really want to have a good sleep environment where it's dark, it's quiet, But I think the biggest thing is being careful about alcohol, being careful about caffeine, and really turning your electronic devices off and getting your body kind of your mind slowed down and into a state where you're more ready to go to sleep and have a good night's sleep.
Yeah. All great advice. I started putting my phone not next to me anymore, across the room. So it's not even near me anymore. And that's been really helpful.
Yeah, exactly. Just a big thing, and you just got to turn that TV off and maybe read a book, look at a magazine, just something to slow your mind down.
Yep.
Yeah. Yes. Such great advice. Well, this was a wonderful conversation. We absolutely loved having you on. Thank you so much.
Well, it was an honor you had me.
Yes.
And I think it's great information. I feel like not everybody knows how important urologists are. So I think shining a light is important for our listeners.
And we appreciate you and just your perspective on it all, of looking at the whole patient and the whole person and that listening ear. And I think it's a reminder to our listeners too, that, if you don't feel heard and you're not feeling in that space, to keep looking, right? To find the right doctor, to find that right doctor-patient connection. So, so too bad we don't live closer.
Hey, everybody else is moving to Tennessee. Maybe you guys should.
Yeah, there we go. It's looking a lot warmer in Tennessee than it is here. I'll take 40, 50 compared to 17 any day.
Yeah.
Well, thank you so much again. We appreciate you.
Well, you're very welcome. It's been a pleasure, and be glad to come back on anytime if you guys want to talk a little bit more about anything else. Just reach out to me.
All right, we would love that. You have a great rest of your night.
You too. Bye-bye.
Bye.
So before we leave you, another quick shout out to our sponsor, Cozy Earth. Treat yourself or someone you love to the softest, coziest sleep at CozyEarth.com with our exclusive code IGG at checkout.
Are you loving the podcast? The best way to show it is by leaving a 5-star rating and a few kind words. It helps us to keep growing and reaching others who need to hear they're not alone.
And be sure to join our email list. The link to sign up is in the show notes or in our bio on any of our social media platforms. Being a part of our email list is the best way to stay up to date on new episodes, special guests, recipes, book recs, and so much more.
You can also connect with us anytime on Instagram, YouTube, TikTok, or Facebook. Just search Ive Got Guts Podcast or email us directly at ivegotgutspodcast@gmail.com.
Thank you so much for being here and for being part of this community. We're so grateful for you.
Keep going,
keep growing,
and always remember, you've got guts.